Hi, everybody. My name is Stu Gold. I'm here with Rob Holton, and we're here to introduce you to our very exciting health tech startup, Actual Healthcare Solutions, or AHS. Actual Healthcare Solutions is an AI-powered patient referral platform that is addressing one of the biggest challenges in the medical industry today, which is the ability to connect the right patient with the right physician at the right time in a way that's going to provide better healthcare outcomes as well as better financial results for the physicians themselves. Now, we're not just another venture-backed healthcare startup. We were built by physicians for physicians who have actually been living with this problem for over 25 years. AHS is actually the brainchild of Dr. Jamie Wisser, a New York-based surgeon from both Harvard Mass General Fellowship Program, as well as Johns Hopkins.
So just so we're clear, at Actual Healthcare Solutions, we are focused on accelerating time to critical care, and in doing so, improving healthcare outcomes and fundamentally transforming the economics of the medical practices. So let's take a quick step back and understand why is accelerating time to critical care so important. In healthcare, we know time matters, right? But in specialty care, delays can be deadly. I'm sure most people here in the audience have had some type of experience with healthcare delays, the impact that has had. For me, it was my father who was literally days away, if not hours away from dying. When he finally got in to see the specialist, they found a 90% blockage of his heart. It was the widowmaker. He had emergency double bypass surgery. They put 4 stents in. Fortunately, my father is alive and with me today, but he was the lucky one, and things have to change.
Wow. So that's a perfect example of exactly why we started Actual Healthcare Solutions and built the LMRx platform. So let me put a little bit of numbers behind the situation that Rob's father was just in. 80%, approximately, of all issues that are related with healthcare outcomes are related back to missing information from the provider itself that is actually given to the provider during the patient handoff. Now, what's the bigger issue is that 20% of all malpractice claims, 20% are directly attributed to missing information that happens when the primary provider is giving information and sharing information with the specialist. Now, why does this happen? It happens because all electronic medical record exchanges are islands. They have been purposely built to capture all of the patient information, but make it extremely difficult for physicians, healthcare systems to actually share that information with each other. And this is a big problem because what's happening is that you literally have all of the major EMRs in the world, like Epic, Cerner, Athena, they're literally on their own island. All of the radiology reports we were just talking about, the x-rays, the MRIs, all that stuff that we all get, they're literally on their own island. And if you're a medical system, a healthcare provider of any sort, and you actually want to share a patient information with another healthcare provider, you're not just on another island, you're literally speaking a different language. So what we've done is AHS has built a bridge that connects all these islands together seamlessly.
And so our bridge, our platform, LMRx, is HIPAA compliant. We're already fully integrated with the majority of the EMRs that are on the marketplace. We have built the bridges that connect the disconnected, from the referring physicians to the specialists, from the medical practices to the hospitals, the surgery centers, the radiology centers, even across entire health systems, regardless of the software or the versions that they're using, we've built those bridges. And it's powered by our industry-leading AI. So, for example, our AI referrals. We can transfer fully encrypted patient data instantly from the primary care physician to the specialist. Why? So that the specialist has all the information they need before the initial visit. Our AI radiology examines all of the raw MRI, CT scan files, and can generate the initial radiologist report and the clinical decision in under 30 seconds. More powerful than that, the specialist can now ask follow-up questions of the AI in real time, generating additional valuable insights and clarity in seconds instead of days and weeks. And our AI clinical notes takes all of the unstructured data from all of the doctor's transcripts and creates the required SOAP notes, the patient summaries, and we can even extract the critical patient data and treatment data and automatically put it into the patient record, the patient charts, the medical records inside their EMR in real time. We are reducing the paperwork, we're increasing the accuracy, and more importantly, we're accelerating those decisions.
Rob, sometimes I like to say, we talk about it a lot, we've really built bridges between all of these separate islands. But in many cases, when it comes to our technology, we've literally put the express lane in. We're not just sharing information, we're using artificial intelligence, not by building it, by being able to integrate all of the best AI applications that are out there and putting them into our platform in a way that we can always upgrade them to whatever the latest technology is. So it's not surprising that we're already starting to get tremendous traction in this space. We have already had a very successful pilot with one of the largest New York University healthcare systems. We're working with a new program with Coastal Healthcare that I think you're going to be on a panel talking about later today. We are working with the Pancreatic Cancer Association Action Network, PanCAM, in a number of different ways, not only on patient to specialist referrals to literally help drive better patient outcomes, but they're even using our own product and our data to train their own large language models. Now, on top of all this great stuff, we actually have a very robust sales pipeline. We have over 30 active opportunities across individual providers, healthcare systems, and university medical centers.
And so it's no surprise that Actual Healthcare Solutions has been called a game changer in the referral technology and health information exchanges. We're already endorsed by physicians, specialists, radiology centers, and medical practices around the country. But do we have competition that are trying to save this same problem? Absolutely. But here's the thing, our competitors are focused on tiny or individual pieces of this very complex puzzle, a single island. But as we've been talking about, it's not about the single island, right? It's about building bridges and connecting all of the islands so that we can accelerate care and deliver true value in healthcare.
And what's the value for us and for our investors in doing so? Well, the patient referral business in the US alone is over $5 billion. And that doesn't even take into account the value of our artificial intelligence platform and the integrations that we're already moving forward with.
So our business model and our pricing model, it's fairly straightforward. It's a SaaS subscription model. We charge the specialist $10,000 per year, per specialist per year. We are on track to execute on 80 billable practices and over 800 subscribers by 2026, where we'll generate roughly about $10 million. In 2027, we're on target to hit a little over $30 million. Now, ideas are easy. We all know this. Execution, especially in early stage, is everything. And that's why we've assembled a powerful team of operating executives that all have early stage experience. We have a proven track record of execution in early stage. Collectively, we've already generated over $1 billion in revenue in early stage revenue, and we've had 7 successful exits. In addition to Dr. Jamie Wisser, who we talked about earlier, our founder and CEO, I'm the COO. I've had over 20 years of experience of building, leading, and managing early stage healthcare technology companies. Stu Gold has developed multiple successful companies inside of both Microsoft and Cisco, and he's already had 2 successful exits in the AI marketplace. And finally, our CTO, Ganesh Mata, is our architect of our AI technologies and our health data integration platforms.
All right, so where are we? What's our ask? How do we continue to move forward? So we've already completely raised, and we're very excited about our friends and family round in which we raised $1 million. That has already gotten us to where we are today. Now we're in the process of actively raising another $2.5 million. that will help us continue to scale our business, build out our infrastructure, start to expand our sales and customer support team due to all the clients that we're bringing on, and continue to build new platform enhancements. If you invest with actual healthcare solutions, you're honestly not just building more bridges, you're saving more lives from the patient quality of care perspective.
So we invite you guys to join us on this journey in transforming how healthcare connects and be a part of the AHS solution. Because remember, every day that we wait, those islands get a little further apart. We're ready, the market's ready. Please join us in revolutionizing healthcare data integrations. We are Actual Healthcare Solutions. Thank you all very much. We look forward to aggressive questions.
Thank you.
In the panel.
Can you talk a little bit about your traction to date and specifically the New York pilot that you mentioned? Did that convert to a sale?
So our biggest client right now is Coastal Health. We're actually on a panel with them in about an hour talking about why they actually went with us for our AI radiology. That's a typical type of client that we have because we are dealing with an end-to-end product base that involves not just AI radiology, dictation, right, driving referrals. Coastal decided to go with us because they saw the value in accelerating what they do, 20,000 surgeries. The ability to streamline that AI radiology piece was critical for them, and the value add was huge.
And in regards to
how much revenue
direct
do you have
question,
to date?
the original pilot was with the NYU Langone Medical System. That actually got us into the Columbia University Health Information Technologies Lab, or what's called HIT Lab, and we're now continuing to pilot in both of those two places.
Got it. And what's the revenue to date?
We'll do $300,000 this year. We may be announcing a contract that we can be higher than that this year.
Can you talk a little bit about your go-to-market strategy and what your plan for sales is?
Yeah.
Sure, absolutely. From a go-to-market strategy, in the beginning, we've been targeting large orthopedic groups. The value add that we can bring to the table in terms of reducing the number of missed or canceled surgeries, as well as being able to drive new patient revenue, provides an ROI very easily over 400% for them. So we've targeted these large practices. We've, because we're still an early stage company, instead of bringing on the salary expense, right, of full-blown sales teams, we've contracted out with very capable large sales groups that has a nationwide approach, right? So we've actually already presenting and negotiating contracts that are in the Pacific Northwest, that are down in Texas, as well as the Northeast.
And can you, just to follow on to that real quick, can you talk about your cost of acquisition in that model?
So I will have to get back to you on what our total cost of acquisition is, right? Because as of right now, with a handful of clients, it's quite large. But because we get such substantial organic growth, right, through these practices, we may get the first two specialists on, right, which is going to be only $20,000 a year. But within those practices, they'll have 20, 30, 40 other specialists, right? It's kind of a land and expand strategy. So from a customer acquisition cost standpoint, right, it's de minimis, and we're just amortizing what that cost is.
So my question is, what is the competitive moat? You hear this before from your either the healthcare organization creating something similar, let's say maybe not as great and cool as you guys have put together, or somebody very, very large deciding, hey, this is a lucrative enough space you guys have uncovered. We're gonna put resources against that and try to crush these guys.
Yeah, it's an excellent question. What we've already discovered is that they don't have any really good incentive to actually solve this island problem, right? In fact, they've made the problem even bigger. We're currently working with clients who are on one version 8.3 of Athena, or on Cerner, or on Epic, these large EMR platforms. They're even struggling just to move them to the next platform at the next level. And in fact, they're coming to us to say, wait, can you bridge that gap for us right now? So again, why would one of the large EMRs want to interconnect with the other EMRs? Their entire business is on controlling that information and controlling that data and making it more challenging, not only to shift, but sometimes even to upgrade. And what we've created is this bridge not just between the EMR systems, but we've also created a bridge from version 1 to version 3. You know how long it takes Mass General to convert from one to another? Years and millions of dollars. What do they do in the interim? They're coming to us.
And I'll follow up real briefly on that, on a real life example. So, what's interesting is the way our architecture of how we are integrating with all of these different EMRs on a bidirectional basis, right? It's not just a push. We push-pull, we can actually write into the patient charts. It's a unique architecture in the way that we do it and the access that we have to the data. We sat down with one of the top 3 largest radiology corporations in the country. They do 1.2 million scans a year. They're doing over $800 million a year in revenue. One of the biggest problems that they have is being able to do financial clearance of scans, of MRIs and CT scans. Those are causing days and days of delays to being able to get patients in to get an MRI. Their biggest problem, they can get the order from the EMRs. They can't get the clinical notes. Now, this is a multi-billion-dollar company, and they've flat out said, nobody in the industry has solved this. We actually have. We have access to all of it. Right? So we're working together to put a really large deal together with them. We're also part of the Coastal Health Group as the pilot of this program.
So your land and expand concept, right? If you're charging $10,000, what are the average sizes and how much money is your ticket for that organization you're working with, right? What's the client value of each client, right? So Coastal, you say, Coastal has how many people then at $10,000? Your other clients have how many people at $10,000, right? Because it's not $10,000 per organization, right? So what are we talking about from a size and scope perspective of revenue?
Right, so for Coastal, that has...
Average 10.
What?
Between small and large, which is exactly why we're aiming for 80 different clients this year, but over 800 billable subscribers. And we're on track to get that, and that's what will get us to that first $10 million. Yeah, excellent. Thank you all very, very much. We appreciate it.
Thank you very much. Sorry for running